You are a skinny looking girl, aren't
I
you?
know.
Tighten it up. Check out your muscles.
Wow.
Hi, good morning everybody. I'm Dr. Sue at Art Lipo, and this is our patient here,
Allison,
Allison, and you came all the way from
California.
California. So appreciate you watching, and we're going to do a case of our celebrity arms liposuction, which is our trademark procedure, which is the high definition circumferential, or what you call 360 lipo of the arms, which we're one of the very few in the world that do that. So anyways, Allison, do you mind telling everybody, what, how this has bothered you and, why you want to do it?
I carry a lot of weight on my arms and my back, so I've been wanting to do this for a long time, and I've been seeing a lot of doctors, and none of them could do what I wanted until I found this clinic and Dr. Sue, and here I am. I'm excited.
Yeah, and I don't think there's any place in the world that has more plastic surgeons than the LA and Beverly Hills area, right?
Right.
Yeah, but we do something very special, and like you said, it's not an easy thing to find someone that can do this. And I'm going to tell a little bit about what I was telling you, okay? So obviously you guys can see that Allison is a very petite little girl. Look, just raise your arms up, okay? See this frame right here? She's got a tiny little waist. She's a tiny little girl. And when we put her arms down, there's a number of different things that are going to improve and look better. But right away, that you can probably see this silhouette right here, which because it's on the sides of her arms, it's the fat that never goes away, right?
Right.
And you work out all the time.
Right.
What sport did you tell me you were in?
Oh, I run half marathon, and I run
Half marathon.
and I run every day basically, but nothing came up.
Yeah, this area doesn't really want to go away on her body. Maybe on some other women, but most women, that arm fat's very, I call it non-metabolic fat, or it just doesn't want to go away when you're burning calories. But anyways, from this view right here, it's on the side of her arm. When we turn her this way, you can see it also comes to the back, so it makes her arm look wide this way. When we bring our arm like this, you see it's hanging down right here. So, and then if you make a muscle right there, you just can't see her muscle. But when we're done, we're gonna see something like this right here, where you can see her shoulder contour. We'll see the nice shape of her arm underneath. So different from this. We're gonna work into this upper back area. Upper backs are one of the optional areas, but it's very important on some women. So anyways, when we get your arms looking the way that you want, what's gonna happen? You're gonna be doing anything different?
I'm gonna wear a lot of tank tops. Showing arms off, so.
Right, so she's from Southern California. Okay, so this is gonna be great. Thanks, and we'll be back to show you some immediate results in a little bit, okay? You ready?
Right, yeah, right.
Okay.
Thank you.
Bye-bye. All right, how you doing, Allison?
I'm doing good. Thanks.
Okay, so for our audience out there, what I'm doing right now is this is our fluid cannula, and this is how we put in our numbing fluid, and that's what we're doing right now. Does this hurt at all?
No.
Okay, did it hurt a little bit when we first started putting it in?
Yes, it's just the pressure, and I feel like a massage from the inside.
Okay, so before we start, everyone's completely awake, and what we have to do is we have to put in our numbing fluid into the fat layer. So that's the kind of uncomfortable step that people talk about, and that's what Allison was telling me about right here. Okay, why don't you go around this way now? Okay, I'm going to we've finished putting in the numbing fluid. And what we're going to do now is we're going to go ahead and start the liposuction part. We've actually been going back and forth, so most of this is numb now. Do you have the pedal?
Nothing.
Okay, on. Okay. So we do everything awake, and this is our interactive process where we actually have our patients tighten their muscle. Okay, so Allison, you hold tight right here? And she's holding her muscle tight so I can actually grab and tense and control this fat in a way that doctors cannot do when the patient's asleep. And this is what allows me and doctors my doctors that are doing this to know exactly where we are and get close to the surface of the skin. So tell me if this is hurting at all, okay? This is the lipo part. How's that feel?
Nothing.
Nothing?
This is numb.
Okay. And if you can show them the tube essence.
Yes.
This is the fat going through right here. Okay, and I can feel her deltoid muscle, which is a shoulder muscle. I'm working on the front of the arm right now, where there is a nice contour that we have to reveal, and that's the contour between the bicep and the deltoid. Still doing good?
I'm doing great, thanks.
Okay, no pain at all, right?
No.
Okay. Every time I do a little bit, I take a look, make a muscle for me. Okay, so I get to see this, and that's one of the advantages of doing this awake is that I get to see the muscles when they're tensed up and the contours for what they are. So anyways, we're going to continue this, and then we'll come back after we're finished, okay? Any comments?
No, great. I just can't wait to see my arms.
Okay, all right, we'll come back a little bit. Hello everybody, we're back. Allison, how you doing?
I'm doing great, thank you.
Okay, we have just finished Allison's left arm. Her right arm is not done yet. But tell us, how was everything?
This was quick and tolerable.
Okay, I had you tensing the whole time, right?
Right.
Was that difficult?
Yeah, it's a workout.
As a workout. But how about, was it stingy or painful as far as what we were doing?
No, it was numb.
Okay.
It's just a little pressure, but it's just tolerable.
Okay. Well, right now, I'm going to sit you up. Okay, and you can stay right there. And our audience gets to see before you do. Oh my goodness, I see some nice shoulder. I see a skinny arm. Okay. Do the cheerleader thing for us. Okay. Okay, come on, let's go in front of the mirror. Hold on one second. Okay, good, go ahead. We'll just move fairly quickly. How do you like?
Smaller. And
Smaller.
It went in. It's not
And
popping
can
out.
you see the contour of your shoulder?
Yeah.
You see the contour right there?
Yes.
Turn a little bit so you can see it from the side. Awesome. Okay. And then do the turn facing the mirror again and do the cheerleader. Do you see something that you like?
Oh God, this is smaller.
Does it look more toned?
Yes.
Okay, let's go up here. Okay. What do you see?
I see lines and cuts.
Lines and cuts in your muscle, right?
Yeah.
Okay, okay. Yeah. Do it, tighten the bicep. Okay. And a fit arm versus the other?
Yeah.
Okay, I'm going to show them your backside from here. Okay. Yeah, raise your arm back up and just do that muscle thing. Okay, right there. That is a nice fit looking arm versus, okay, come on back. Okay, for the audience out there, you can say, how are you feeling?
I'm feeling great, thank
Okay,
you.
so for our audience out there, I was telling Allison that her skin was going to pull up and tighten because she was really concerned. Yeah, she was really concerned when she talked to me earlier. She said, you know, that this whole area, she had been to 10 different plastic surgeons out in Southern California.
Yeah, more or less.
Some very prominent ones too, that all told her she needed her area cut, not lipo. They said that, you know, the skin would be too loose, right?
Correct. There's a lot of skin, so I need to get the arm lip.
Okay, so can you see how your skin already popped all the way up?
Yes.
Okay, and this actually going to be even better by tomorrow. Okay?
Okay.
All right, so just wanted to mention that the skin tightening is a strong aspect of how we do things here. And we didn't use any extra devices or anything. This is just through the lipo. Okay, let's lay you back down, okay? Hey, Allison.
Hi.
Hi. Okay, so I'm Dr. Sue, and we're back here. We just finished the second side. And Allison, tell us how it was for you.
A little bit sore, but so far it's been great.
Okay. Was it a little bit difficult to deal with some of the discomfort when we're doing it?
The second part, because I guess it's it's the second arms.
Yeah.
So it's
So some discomfort,
longer.
right?
Yeah.
Okay. So I'll tell you what. Let's go and have you sit up. Okay. And you haven't seen anything yet. I'm just going to show everybody here how it looks from the front. I'm going to walk around. You feel okay?
I'm feeling great.
Okay, come on down. This way, come on down. And then let you come on up in front of the mirror. Take a look.
Oh my gosh.
You are a skinny looking girl, aren't
I
you?
know.
Petite now, right? Completely petite. Oh, do you see how your breasts also look nicer?
Yes.
They stand out now. Okay, go and turn and you can see the side of your arm. Okay, that's the first one. Let's do turn so you can see the one we just finished. There we go.
Oh, it's
They're not-
smaller.
Okay. Oh, yeah, small and nicely shaped. Face the mirror and do the cheerleader for us quickly. See some nice shape here.
Yes.
Okay, now do the muscle pose. Tighten it up. Check out your muscles.
Wow.
Okay, and then I'm just gonna get it from behind. Okay. Okay, the skin tighter, pulled up more. Bring it down. Let me see your upper back. Okay, got a good shot of your upper back. Great. So I know you're getting a little bit lightheaded, so if you're okay, let's lay you down. You okay? Say
Yeah,
bye.
I'm good.
Say bye.
Bye.
Okay, how do you like everything?
Great. Thank you. It's so worth it.
Okay, awesome. This is one day follow-up for Allison. And how you doing today?
I'm doing great. Thanks.
How bad was the recovery last night?
It was not that bad. It's just a little sore,
Okay.
but it was great.
So if you guys remember yesterday, Allison was real puffy here. You could this made her look like, kind of chunky, even though she's so petite. Now she's super petite, and all we do with arms. Okay, so last night was pretty sore, right?
Yeah. And yesterday was like big right here, so my arm would move. Was like before the surgery, it was up here like this because of the armpit.
It kind of sat out a little bit instead of laying down your side.
Yes.
Yeah. Now you're a total petite. No one could say otherwise. But yesterday, before that, we could see that it didn't look petite. And I'm just taking a picture right behind. Okay, there's a little bit of indentation where the garment's been, but it looks great. Do the cheerleader for us. Wonderful. Now let me see muscle pose. Muscle. And then you can see we got some muscle definition here. And right here too, we can see some muscle definition. Okay, awesome. So Allison is bruisey, but we saw that yesterday. So bruising is a temporary thing. Not everyone's going to be bruisey, but she is.
Yeah.
Any last comments, Allison?
I love it and totally worth it, and because I'm easily bruised normally, so this is normal for me. So.
Okay. Turn for you facing us. Say bye-bye.
Bye.
Bye-bye. Thank you so much. Bye-bye.